Hello everyone and welcome to another episode of Ask Dr. Bob. We have some very interesting, never asked before questions, which is always a pleasure. Dr. Bob, I had the saliva test done and showed my progesterone, which happens to be one of the steroid hormones, was below normal, and I have adrenal fatigue. I am trying to conceive, and I know this is a factor. What can I do to help alleviate this? Well, what I have found oftentimes, and I talk about this in Dr. Bob's Drugless Guide to Balancing Female Hormones, progesterone is very important, now listen to this, for the conversion of T4 to T3, which is a thyroid hormone. I've had practice members have challenges getting pregnant, and you can do a YouTube search on this, Dr. Bob Infertility. With one of our practice members, her name was Michelle. We improved her progesterone level. That helped the conversion of T4 to T3, which meant her thyroid gland was functioning optimally. There's an exciting book that you can get called Adrenal Fatigue. I'd encourage you to purchase this book by a gentleman by the name of James Wilson. Minimize sugar, minimize fruit. I don't necessarily promote progesterone. I'd rather have your adrenal glands function optimally. That is the key. I would also purchase Dr. Bob's Drugless Guide to Balancing Female Hormones. That will make a huge difference. Dear Dr. Bob, my boyfriend has hepatitis C. What are your recommendations for him? Well, first, you want to improve, obviously, liver function. Silymarin, which is found in milk thistle, helps promote optimal liver function. Eat sulfur-based foods. Of course, no alcohol, no sugar, any kind of medication that would compromise liver function. Dr. Bob's ABCs would be a very wonderful idea. I personally take dandelion root. I would really want to know the boyfriend's liver enzyme level. We have a variety of liver products that we use. One is called MCS2, which helps promote glutathione, which helps the metabolism of proper liver function. Sulfur-based foods are also very excellent. Dr. Bob, my mother suffers with severe depression and a discontrolled thyroid problem since 1971. I was a junior in high school by the way, at that time. So many doctors are giving her medications. I'm tired of doctors. My mom worked for 39 years with an electronic soldering company. And I know that when people weld and have solder, they have heavy metal toxicity. I'm sure the heavy metals are sabotaging your mom's ability to have optimal thyroid function. There's a product that we use called chlorella, which helps eliminate and minimize heavy metal toxicity in the body. We also use a product called cytosine parotid, which also gets rid of heavy metal toxicity. I would definitely have a TSH, a T3, and a T4. You may want to consult with us at druglessdoctor.com so we can help naturally, because there's a lot to all this. Oftentimes we have proper T4, which is a thyroid hormone that cannot convert to T3. You may want to do a Google search on me for that. We can help that particular area. Dr. Bob, I wake up with bad headaches, and sometimes as soon as it gets up, I feel better. When you wake up with a morning headache, it's usually subpar thyroid function, because your thyroid gland has everything to do with blood sugar metabolism. Morning headaches that go away as the day goes on, always thyroid. Very last question. This is so intriguing right now because of what we're going on with our sports arena, and one of the announcers has a stye. The official name for a stye is a hordeolum. A hordeolum is the name of that lesion or irritation in your eye, usually bacterial involved. So if you have a chronic hordeolum or stye, I would eliminate sugar. I know in a chiropractic practice we oftentimes find misalignment in the upper cervical spine. Misalignment here affects the nerves that go to the eye. We use a product called Agricept L. It's a citric seed extract. Unhealthy people will have continuous hordeolums or styes. Get your hand out of the cookie jar. My name is Dr. Bob DeMaria, and thank you once again for watching us, the Ask Dr. Bob.